August 28th. So please do provide your feedback and input on the IDD integration plan. That form stack is on the DIDD website. And we have received much feedback already, and we really appreciate it. And based on some of the feedback we got early from families, as I talked about, I think the last time and the time before, we really saw the need to make sure that we were providing the information in a family-focused way, specific to families, because our last two IDD integration WebExes, because there are so many stakeholders that are interested and have questions, ended up being more tailored to the provider point of view. So we are having a family-focused IDD WebEx, integration WebEx tomorrow from 3 o'clock to 4 o'clock. We will be recording it if a person cannot make it. And we are hoping that families will find it to be useful for them and help them submit feedback to us to let us know what they like and what things they want to see in a new program. So with those reminders, I am going to start out by turning it over to Dr. Bruce Davis just to talk about staff testing and give us an update there. Dr. Davis.
Yes, so I know a number of agencies have worked at getting their staff testing together. This is, something that we've been strongly encouraging, that the Department of Health has recommended for agencies out there. I think we're sticking with strongly encouraging this, not mandating it at this point, and not really thinking about mandating it, but it is a wise idea for agencies to enter this process of staff testing. It gives you a lot more information. I have become aware that there are problems with the Everlywell reporting, and so we know that those results have to be reported directly to the staff member, and then collecting those results back from the staff member has proven to be a headache for many people in trying to implement this system. And I have discovered that the P23 tests that you're also authorized to order, so those are that's the other test that's listed on that order form that you do through TEMA. That order form, if you order those P23 tests, P23 offers a web portal by which the agency that's providing the test can check the results, and also allows someone at the agency to designate an email, that you could designate an email at that agency for the agency to be able to receive the results via email as well. So what I would recommend is that if you have ordered the Everlywell tests and have not used them yet, that you go ahead and make an order for the P23 tests instead, if you want to move in that direction, and to hold the Everlywell tests until those are delivered. It's my understanding that you can give the Everlywell test back to whomever delivers the P23 tests, and that they will take them back to TEMA. So that's my recommendation. If you've already started the Everlywell testing, you can go ahead and proceed with what you've done. But I would suggest as quickly as you're able to switch over to the P23 test. I think that's about it, Kara, with respect to the testing at this point, unless there are any questions about it.
All right, and thank you, Dr. Davis. And I see some questions in the chat box about some other testing things, so we'll get to those once we go through the questions that we have that were submitted. So the first question we have that was submitted was for those coming off the waiting list, will they come through the 1915C and ECF choices, or only ECF choices? Jordan, would you like to answer that question?
Sure, thanks, Kara. Good morning, everybody. So at the point at which we start to bring people off the waiting list, obviously with the 1915C waivers being closed, those people will enter through the ECF program. The only pathway for enrollment at this point is the ECF program, so we don't plan on making any change there.
All right, thank you very much, Jordan. And we did get two separate QA questions, so I'll read them both, and then we'll have Pat Nichols discuss. The first is after integration, will there be one all-encompassing QA survey across each service, or will agencies providing multiple services have separate surveys for each, like ECF choices in the 1915C waiver? Actually, Pat, if you want to answer that, and then we'll get to the next question, you can answer that as well.
All right, sounds good. Good morning, everybody. Hope all is well with everyone this morning. The short answer to the question is yes. There will be an aligned system across the two programs as we move forward. Our goal is going to have an aligned QA process since the systems are aligned, and there will be the same requirements going forward. So that's the short answer. I would go ahead and add, however, that this is a really good opportunity for us to look at and evaluate all of our current components within the two processes to ensure that as we move forward, they are in alignment and that they measure what it is that we want to measure. So I think that the answer there is yes, and we are going to be working on that and are working on it currently. So thank you for that question. Back to you, Kara.
All right, and then 2A is what is the stance of DIDD QA in regards to delays in preventative medical care for individuals? We have been instructed to use telehealth as much as possible, but individuals are still in need of routine labs, mammograms, wellness exams, and preventative testing. Will agencies be waived from penalties during inter-surveys for not completing these assessments in a timely manner?
There have been there have been a number of things that have been issued about particular requirements, whether those are either in Appendix K or in some of the other documents that have been sent out across the months. But I believe that the answer would be that we are going to be looking to see if there has been an attempt made to schedule preventative appointments as they are needed. However, we are also going to be flexible in understanding that these things cannot be done sometimes at the behest of the practitioner. So we're looking for just a note to say it's been attempted and that you'll continue to try to do this as things move forward. Thanks. Kara?
Wonderful. Thank you very much, Pat. The next question is I'm going to turn over to Dr. Davis, and it says, we know that COVID-19 can decrease oxygen levels in some individuals. During this pandemic, would it be possible for DSPs to use a fingertip pulse oximeter to check oxygen levels with the physician's order to do so? Dr. Davis.
Yes, there certainly with a physician's order. In that physician's order should be instructions about what to do if the oxygen rates or levels reduced to a certain level. That there are actions that are prescribed by that physician. You actually could do this even without a doctor's order, although you do need to be very clear on what you're going to do with that information. And so when a person's oxygen level reduces to a certain level, you need to have certain actions that you're going to take and know when that you need to contact a medical professional to assist you with that. Kara.
All right, thank you very much, Dr. Davis. Okay, we will now start to go through some of the questions in chat. Teresa answered this question in the chat box, but I'm going to turn it over to her to just explain what she said in the chat box. It was, what should the process be for notifying agencies of a potential exposure for staff at another agency? And Teresa, can you kind of reiterate what you put in the chat?
Sure. DIDD has a process in place where we are contacting agencies who have a staff person who may have come in contact with a person who tested positive for COVID at another agency, or who came in contact with someone who may be COVID positive. That process starts at the central office level when we have a call come into the hotline of a positive test. During that call, the investigator will ask for any other folks that the person has worked with, plus the last four of their social security number. We then use that to look in the Relias system and determine what other agencies that person has an active profile at. Once we know that, that information is sent to the regional nurses. And the regional nurses are then reaching out to the provider agencies and letting them know that, Bob Smith, who works for your agency, has come in contact with someone at X agency who's tested positive for COVID. Now, Lori did say in her message that she thinks it's stopped being done consistently in the regions. If that is the case, please contact David Taylor. He's overseeing the regional nurse component of this. And just let him know what we're seeing is inconsistent, and he will take care of it immediately and make sure that there are consistency among the regions. Thanks.
Thanks a lot, Teresa. I see another question about the PCP, but that was answered by Pat. So unless that answer was not, I feel like that answer sufficed for the question about the delay of physicals. Does testing blood oxygen level with a pulse oximeter require nursing delegation like checking blood sugar or blood pressure? Dr. Davis?
Again, you need to know what to do with the results of it when you conduct a blood oxygen level. So, this would be something that would be delegated by a nurse or could be ordered by a physician as to, as you conduct the test, as you take the blood oxygen level, that you would know what the instructions were if that blood oxygen level reached a certain point. And so that's basically, I think, the way that should work. I probably would not recommend that people just out of the blue start taking blood oxygen levels. While there probably is no prohibition on that through the Nurse Practice Act, it is the uncomfortable piece of it is you don't know what to do with that information, and so you need to get medical direction in order to do that from a nurse or a physician. Sarah.
I'm seeing that some providers did not receive open line last week. What do we need to do to begin receiving it again? I'm not sure why you all did not receive open line last week. If you didn't, please reach out to Carly Carlton, and she'll put her email address in the inbox so that we can see it. But just as a reminder, we do always put all of our open line articles on Tumblr, and we will provide that link as well. So if for some reason you feel like you did not receive open line or something happened to it, those articles are always publicly available on the DIDD Tumblr page at the same time as we send it out to the broader list. So that way people can search easier as opposed to having to go through their inbox and look for several Word documents. There is an archive feature on that Tumblr page. So we always have all of that information online for everyone to access as easily as possible, because we understand that sometimes when you're looking for something, even for us, when we're looking for something from a couple of months ago, going through a Word document is sometimes not the most ideal situation. And we are in the future looking to migrate the way we provide OpenLine into a different format. And of course, we will hope that goes smoothly, and probably look to distribute it the same way that the TEIS newsletter is currently being distributed. So that is the answer to that, but please do check to make sure that you are on there. We have heard isolated peer cases before where for some reason people are not receiving it, whether their email filters changed or something changed, but it is always publicly available. All right, I'm seeing that OpenLine went to a person's spam folder last week. So yes, always check your spam folders. Also, somebody is not on mute, so we would ask if that person can be muted. That would be very helpful. Okay, for COVID positive reports, when all staff information which could be in question has been reported and obtained by the on-call investigator and they begin to come back positive, would it be reasonable when additional staff come back positive positive that it be added to the initial report, or should we prepare to provide all the information that was obtained during the initial report? Teresa, would you like to answer this?
Sure, Kara. I may need some clarification. I had a little bit of a hard time maybe understanding. I don't want to answer the wrong question here. But the process right now when staff are tested is that a ref comes in just saying, hey, staff was tested. After that happens, if the test comes back negative, then an updated ref is just submitted saying the test came back negative. If it is a positive test, then at that point, there needs to be a call to the on-call hotline for that positive test to be reported. If you have more than one positive test at that time, you can tell us about more than just that one positive test per call. You can give us other staff and we will obtain that information. But the information I spoke of in my previous answer as well, that we use in order to contact other agencies if someone that works for them may have come in contact with someone at another agency, that is the information that is being collected and that is not collected until there is a positive, and that's collected by the on-call. So I hope that answered the question. I'm not really sure if it did, and if it didn't, if the person could just clarify the question, and I'd be more than happy to answer again, Kara. Thank you.
No problem. Thank you very much, Teresa. I've had a couple of private emails from providers just about the open line thing. Apparently, if you have a Gmail email address, Google did an update last week and it sent open line to many people's spam folders who had Gmail. So please do check your spam folders as well, because it may have been an issue with that Google update. Okay, we have another pulse oximeter question. Is it expected that pulse oximeter monitoring be delegated by a registered nurse? Dr. Davis.
Yes, it is expected that it would be delegated by a registered nurse, or that it would be ordered by a physician, as was previously asked. So you need to have medical personnel involved in that that process when you're doing that, so that they can establish the limits of the blood oxygen levels that you're measuring, and when to contact someone to take an appropriate action on that.
Hey, Dr. Davis.
Yes, jump in, David, please.
Hey, this is David Taylor. It doesn't actually require nurse delegation. It's blood pressure monitoring and pulse oximetry are non-invasive tests, and they don't actually require an order for them to be for it to be done. But the nurse needs to provide training specific to the needs of the individual and the staff that are being trained. For instance, if ideally the doctor's order, you would get a doctor's order for pulse oximetry monitoring, and that doctor would write those parameters for reporting in that order. If a nurse just wanted a staff member to check it, they need to train that staff on how to properly use the probe and when to report the results. So it technically doesn't need to be delegated, but there does need to be some training for that staff by that nurse, and then ideally have an order from the doctor with some parameters for reporting. But staff can take an electronic blood pressure reading with take blood pressure with electronic cuff without without delegation, and the same applies to the pulse oximetry.
Thank you for that clarification, David. Kara?
The follow-up question, since we do have David on the line right now, is can the training be done by an LPN as well as an RN?
I would see no problem with that, because it's not a delegation. If it's a delegation, it needs to be done by the RN. If you're just training the staff on how to use the probe and the reporting parameters for that person, that would be fine to be an LPN.
Okay, we had a question. Please review the process providers follow to obtain tests for people supported once there is at least one positive staff identified working in their home. I guess I'm going to guess that this means the tests that are available through the regional offices. And Bruce, would you like to discuss that?
Can you repeat that question? I was looking for it on here and couldn't find it.
Please review the process providers follow to obtain tests for people supported once there is at least one positive staff identified in their home.
Well, you can go through several different methods to do that. We do have the capacity to be able to offer some testing through the regional offices. If you, and that would be the path group testing that has the anterior nares test that we were using when we were doing mass testing. So if you contact your regional office director of nursing, they would be able to discuss that with you and arrange it for you. What we would require under that circumstance is a doctor's order to conduct the testing. So whoever the person's primary care provider is would need to provide an order for that. And then with that order, we can conduct the testing. You could also go through, I'm sorry, I kept making you think I was through and then I wasn't. But the other part of this that you can consider is having the person tested at the local health department as well. There are other options that you have for doing that, but we offer this option if you prefer to go that route and to get that anterior nares test. Kara?
All right, thank you very much, Dr. Davis. Do we have any other questions? The chat box is looking like we've gone through all of the questions in the chat box. So I will pause for about 10, 15 seconds to see if anything else comes in. And instead of pausing, I'll once again encourage you all to share with your families the information about the family-focused WebEx on IDD integration. Somebody asked, where can we locate the MOU? I'm guessing we're talking about the Everlywell MOU, and based on the information about Everlywell, Dr. Davis, would you like to clarify?
I believe that, so the MOU that we have on the website currently may be specified to Everlywell. I think it is still adequate to get you permission to order the P23 tests because you already, when you go in to order, you have the capacity to order those. However, I am going to check to see if there is an additional MOU, and if so, we will post a P23 MOU in the near future. Hopefully today, if we find that there's a different MOU that you need to have for that. Kara?
Okay, and that MOU is available on DIDD's COVID page under the Testing and Results Guidance tab. All of the testing information about staff testing can be found on that page at that area. One more question came in. It was my understanding that staff tested for COVID is only reported to the investigations hotline if the test results are positive. Is that still the case? Teresa, would you like to once again discuss this?
Sure, Kara, and I apologize. I keep getting kicked off some internet connection, so if I stop talking, I know you're fully aware of the answer as well. Yes, the way that it is done, and Kara has a nice chart on our website that clearly shows the process by which it should be followed. We thought that would be helpful since it can be kind of confusing. A ref needs to be submitted for a person supported who having a test done. Then, if the test is negative for the person supported, the ref can be amended. For a test that comes back positive, a call needs to be made to the hotline. For a staff person, sorry, I don't know what that was. For a staff person that tests positive, then a call just needs to be made to the hotline regarding a positive staff person. A ref does not need to be completed for a staff person. We just need you to go on and call up to that hotline. We don't need that initial ref sent in saying staff's been tested. That is only a requirement for person supported. And I hope that answered the question, Kara.
Yes, and there is a one-pager, like she mentioned, on the DIDD COVID page that explains all of the different parameters for staff testing, for person-supported testing, and when that needs to be reported. And we would encourage everyone to take a look at that. There was a question about the birth reports. Providers need to close out their year's financials. I apologize, Donna. I don't think we saw it in the COVID inbox, but we will answer it for you right now. Andy.
Yeah, good morning, everybody. Great question, Donna. So we should be able to get that for you. I'll reach out to you separately to make sure that you have all the information that you need so that you can close out your fiscal year. Thank you.
All right. And it says, do we order the P23 test? I'm guessing we being the provider. Dr. Davis, would you like to answer?
Yeah, I assume that it's the question is whether or not you how do you order the P23 test? Am I sharing my screen right now?
You are, Dr. Davis.
Okay. So the order form looks like this. And so you see that if you've already established an MOU with the Department of Health for using these self-test kits, that you already have P23 nasal swab kits listed on there. So you're able to order those the same way that you were ordering the Everly Well test right there right there on the same form. So it would just be a matter of putting your order on that line versus the Everly Well line. Kara?
Thank you very much, Dr. Davis. We got a question about how can community OT, PT, SLPs become providers for TEIS? Dr. Madison can answer that question.
Yeah, thank you very much, and good morning, everyone. We're currently working on a process right now because I know a lot of people are excited about the transition from TEIS to DIDD, and I know a lot of DIDD providers are wanting to take part. And so, again, we're working on a process to make that as smooth as possible. So hopefully we'll have something in place that we can communicate to everybody, and we'll get that information out as soon as possible, hopefully post it on our website as well.
And I just want to remind everyone that, this office hours with the TEIS providers, therapists, vendors are also welcome to ask questions during this office hours. This office hours is for everyone, not only those who provide waiver services. So we are happy to answer questions about TEIS services and supports as well. Is it expected that hazard pay will continue to be approved for staff working in positive case homes? Andy, you want to clarify where we are right now on hazard pay?
Sure thing, Kara. Thanks. We do want all providers to continue to submit for hazard pay. We cannot guarantee payment at this point. We're still working with TennCare on additional dollars for that hazard pay. So please continue to submit those to your regional offices, but with the caveat that we're still working on getting additional dollars for that. Thanks.
Thank you very much. And I do see the questions about the burst reports or the information about the burst reports, and we are looking at that, and we will take that back and appreciate you guys providing some more detail about that. How long should it take for the MOU to be signed and approved once it is sent into the email address provided? Dr. Davis, do you have any insight into that?
I would say if you haven't heard something from them within 24 hours, we should probably be checking on that. If there is, if you want to engage me directly on that, I will try to assist you in finding out what the status of your request is. Carol.
Thank you very much. And we just got another question in, and I'm trying to read it, and so I apologize if I'm sitting here squinting at my screen. With positive staff, is there any reason why providers can't complete the report and send it in instead of calling the information hotline? because they say it's very time consuming. I'll let Teresa talk about this, but it's really a timeliness issue for us because we have a lot of notifications we have to do to make sure that we are minimizing spread. But I will let Teresa expand on that.
Thanks, Kara. And I do sympathize with the providers because it's a lot of work on our end too, with the on-call investigator having to now take all of these calls, but it is something that we feel strongly about and having that called in. And one of the main purposes for that is really for the providers. The sooner we know a staff person's tested positive and we get that information of their information, their social, and the folks that they've worked with, other staff, the sooner we can call other providers that work with that person. If it comes in through a ref or the inbox that way, it could be a day or even 2 days before we're able to make those calls. And at that point, that person could have come to work for you all and exposed other people. So really the whole purpose of this, Kara is absolutely correct, is timeliness and just doing what we can do to help prevent the spread as quickly as possible. Thanks, Kara.
Thanks so much, Teresa, for that important clarification. Okay, we are out of questions in the chat box. So I'm going to turn this over to Commissioner Turner to see us out.
Yeah, thanks, Karen. Again, thank you to everyone that participated and submitted questions. Very productive day, very busy day, but we know there's a lot of questions, and we will certainly want to make sure we stay committed to getting you answers as quickly as we can, but more importantly, as accurately as we can. So please continue to utilize the email and participating in these meetings on Wednesday. I know earlier we had close to 320 people that were on this call, which is an exceptional amount of participation. And I would encourage you to invite others to the call if they've not had a chance to be on any of these Wednesday calls or they're sporadic in their attendance. Encourage them to be on here because I certainly think it's productive. There's ways that they can learn new information by the questions that are asked from others. And we look forward to doing it every week. So thank you again for participating. With that, I wish you a very happy Wednesday, and you guys have a great rest of your week. Kara?
All right, thank you all very much. And as we always say, we will be back here, same time, same place next Wednesday, and look forward to seeing you all again. Once again, please submit questions to the COVID inbox for this meeting ahead of time if you've got them, because we will always take those first. All right, talk to you all later. Thank you.